All right, so we're just gonna see, what's going on in high blood pressure news today. There's a bunch of articles. Actually, this one on dementia looks kind of interesting. So let's click on that. Hypertension may pose stronger dementia risk for women. Okay. Quick notes. There are currently no effective treatments for dementia, so identifying the most effective ways to prevent the condition is crucial. A new study found that smoking, diabetes, high levels of body fat, stroke, and low socioeconomic status were all equally strong risk factors for dementia in men and women. However, so this is the distinction, hypertension was associated with a higher risk of dementia in women than in men. This was after the researchers had accounted for other risk factors. The results suggest that a more personalized approach to treating high blood pressure is warranted. That's always warranted. For any chronic medical condition, the approach your doctor takes should be personalized and specific to you and based on your race, your gender, what's just going on with your life, socioeconomic status. But it's good that they can see that connection now more and more when it comes to hypertension. Even the ADA, American Medical Association, makes that connection between lifestyle, a person's particular specific lifestyle, and high blood pressure. So I think the medical field is getting better with that. Now as it relates to dementia, it says it involves a progressive loss of memory, cognitive skills, and the ability to perform everyday tasks. According to WHO, around 50 million people worldwide have dementia. Okay, let's go into hypertension more. A few studies have found that all other things being equal, hypertension puts women at a higher risk of dementia than it does men. So let's see, the study followed 500,000 individuals. So this is a big study. They're usually not that big. So more than 500,000 people in this study. Added to the evidence that hypertension in middle age puts women at higher relative risk of dementia. So hypertension, middle age, which is usually 40 to 50, women, okay, higher risk of dementia. And of course, smoking and type 2 diabetes, high body fat, things like that matter. Let's see if they came to any conclusions as to what we can do. Our study suggests that a more individualized approach to treating high blood pressure in men compared with women may result in even greater protection against the development of dementia. Okay, so the study was between 2006 and 2010 in the UK. And it says their average age was 56 and a half years old. Man, that's a long time frame too, 12 years. Let's see what else can we find out. Specifically, as systolic blood pressure in men increased from low to high levels, the risk of dementia declined and then increased again in a U-shaped curve. I'll read it from this paragraph here. However, despite the overall incidence of dementia being higher in men than women, raised blood pressure is associated with higher relative risk in women after accounting for all other risk factors. Specifically, systolic blood pressure in men increased from low to high. Their risk of dementia declined and then increased again in a U-shaped curve. So it's be good to see that curve. By contrast, the risk of dementia remained flat for women with low systolic blood pressure, then rose steadily in line with increasing blood pressure. This kind of steady or linear increase in risk is sometimes known as a dose-response relationship. But simply put, like they are saying, the higher woman's systolic blood pressure is, right, the greater her risk of dementia, period. It's tightly connected. Within the men, that U-shape means at some point, depending on the systolic blood pressure level, actually the risk of dementia went down. But then as the systolic blood pressure number kept rising, then that risk of dementia came back. But for women, it's just linear. The higher systolic blood pressure, the higher the risk of dementia. That's interesting. So this gender-related difference in risk associated with increasing blood pressure was apparent for both vascular dementia and Alzheimer's disease. Okay, so how would that change treatment? Possibly. Previous research has suggested that overall women take more different medications and are less likely to adhere to the recommended use than men. So women usually take more variety of medications, but also not follow the instructions as strictly as men. To me, it's kind of surprising, right? Usually women are more, it's more important to kind of follow the instructions and guidelines and make sure things work out. So I'm kind of surprised that women don't do that. While it is plausible that the gender difference observed in blood pressure in relation to dementia risk may be related to biological differences between men and women, disparities in medical treatment may also offer some explanation. This lack of adherence may be due to women experiencing more unpleasant side effects. Ooh, that's a good point. Let's see. As Gong told Medical News Today, and again, Jessica Gong, a PhD candidate at the George Institute for Global Health. Okay, so Gong says the dose-response association between systolic blood pressure and dementia in women may be due to high blood pressure being less well managed in women than men, given lower treatment adherence on average, compounded by greater polypharmacy, taking multiple drugs, and more treatment-related side effects. Simply put, women are having a harder time being in control of the blood pressure medically through medication, possibly due to side effects, and therefore that is possible. That is increasing their risk of dementia overall when they have hypertension. Gong also said that healthcare professionals should take into account factors such as gender, race, other illnesses, etc. Other illnesses. What comes to mind with me too with this treatment is when women are taking medication for high blood pressure, they're more likely to take other medications, even if it's just birth control. And I kind of wonder if that interaction between those medications has anything to do with it. Clinicians should recommend a tailored blood pressure lowering regimen and other treatment options depending on the individual's risk. In their paper, the researchers note that their study had some limitations. For example, UK Biobank participants are relatively affluent and healthy compared with those in the wider population. They are also predominantly white. So what we have here is a population of middle-aged women, on average 56 and a half years old, with hypertension, white, and affluent, right? That doesn't mean if you're not affluent, it doesn't apply to you, but you have to kind of take all these things into account and know are you really the person that was a part of the study, and to what degree does it really affect you? You have to think about these things. In addition, the database only provides information about blood pressure treatments on recruitment to the register and not any subsequent treatment. The study authors write that this limited their ability to interpret the results. Okay. So that's the article right there. So there's a link between dementia and hypertension for women, focusing on that systolic blood pressure. The higher it is, the more you may be at risk for dementia. So the more important it is to talk to your doctor and say, make sure your medication is lowering your blood pressure and lowering that systolic number, and you're not having strange interactions with other medications, and you're not having this large variety of medications that is creating all these side effects that makes it harder for you to even want to adhere to your regimen. And so now I know a lot of you go to your doctor and you're saying it's hard to find the right medication. If it doesn't have this side effect, that's another. Try another type of medication. That one just doesn't work. But it's vital that you kind of stick to it. Keep searching for that medication that works. And if your doctor is not working with you, consider finding another one, because this is important. Because now your hypertension can lead to dementia later on.